Hi everyone, so this is the interview with Tom Goom, aka the Running Physio. Grab yourself a comfy chair, a notebook and pen and enjoy this one. I know I did. Let's roll the interview. Hi everybody, this is the interview with Tom Goom. Really excited by this, as you've probably been able to tell on all of my social media, Instagram and all the videos that I've been putting out. So to give you a bit of a background, if any of you don't know about Tom and you've been under a rock for the last few years, Tom graduated in 2002 from Oxford Brookes University, and since then has gone on to have a career of almost 18 years now in MSK, specifically lower limb rehab from running. He's kind of taken his clinical specialty into the running arena. And that's not to say, though, that I'm sure, as we'll cover later on, Tom has a wide range of MSK experience. Working in the NHS, has worked in semi-professional football. He's even been to Sri Lanka in 2004 following the tsunami. So Tom has had a really good breadth of experience, which I think today we should be able to draw upon. We've had some superb questions as well. So thank you to everyone who's responded with your questions. We're going to try and cover as many of them as we can today. And if there are any that we can't cover, as I said, I'm going to surely be tempted to ask Tom back for another interview at a later date. I haven't told him that bit, by the way. Okay, so welcome, Tom.
Hi James, thanks for having me on. It's I've been watching your YouTube videos, and you've done some great work on Instagram and stuff like that. So yeah, I've been looking forward to it.
Brilliant, thank you very much. Well, as I say, I've this is the first time that you and I have verbally spoken, as it were. We've been in touch on and off over the years on email and Twitter. So it's for myself, it's a privilege to have you here today and to do this interview. So I'm really looking forward to it. I think we're going to get some great insight into some of your experiences. And as I was saying, you run the running repairs courses, you run the Running Physio website. So we'll get onto that, I'm sure, later on. But some of the questions that we've had in have obviously been stemmed from some of those things. People are obviously really aware of what you do. My first question, though, Tom, is quite a serious one. I think is, what's your plan for haircuts during the situation that we're in right now?
Yeah, I think we might have to get the sheep shears out at some point if it gets a bit ridiculous. I'm okay for the moment, but yeah, we've got some emergency clippers hidden away. So if you see me grade 1 all over, you'll know eventually I've kind of bitten the bullet on that. So
fair enough. I think we're all in the same boat, and I think every day is a hair taming day, isn't it?
Absolutely.
My grey's really coming through. Brilliant. All right. So what I thought we'd do, Tom, if it's okay with you, we're going to start right back from the beginning, because I think, first of all, I'd like to point everyone to your recent YouTube videos, because you've done some really good stuff for students. Particularly, one of the ones I really like is you're reflecting back on your years of practice. I think anyone who's watching this, do go and find Tom Goom on YouTube and search that out. I'm not going to repeat lots of that today, because I'd rather people go and find that and listen to it from your point of view. But going back to your university days, I think there's kind of two areas that I'd like to know about, and that's simply, what was your favourite bit? What was your favourite part of university, and what was maybe not so good for you at university?
Yeah, I think one of my favorite bits actually, is the people that you meet, the friends that you make. That's always something that stays with you. And I still in contact with some people from university, which is really nice. Even though it's 18 odd years ago. One particular thing I think we all liked in the first year was we had a Friday morning massage. That was when we were learning all our massage techniques. So we'd all go out on the Thursday night and have a little bit of a drink, or just one or two quiet drinks, as you can imagine, as students do. We could come in and have a nice soothing massage to get over the hangover. So that was quite a fun part of university. Making good friends and learning a few new techniques and things. I definitely enjoyed that.
Yeah, I bet. So how about something that wasn't so great?
Yeah, the things I found that I struggled with were the practical elements of it, because I think inherently I focused on the academic stuff. Like I did a lot of reading, a lot of revision around like muscle attachments and actions and anatomy and physiology and all that stuff. I really buried myself in that, but I didn't spend enough time doing the simple practical stuff. And as I mentioned in that reflective video, the upshot of that is that I actually ended up failing some of the exams on that, things like the walking aids exams, because it just hadn't really practiced the practical stuff. So I think that's one thing I would say to anyone about to start uni or in uni. Don't neglect the practical stuff, getting used to movement and handling, of, teaching people how to use walking aids, of setting up equipment, because actually, you can learn only so much from a book, but you actually need to do quite a practical job. So you've got to learn that side of it, really.
Yeah, definitely. And I think we're often told, I know at university, that to kind of take every opportunity you can to feel what normal is, as well, and get hands-on. And it's something I think some people find easier than others, though, I would say.
Yeah, absolutely. Because as well, if you don't do that hands-on stuff, when you come to working with a patient, they can pick up on that awkwardness. And it does feel awkward if you're trying to assess someone, handle their legs, move their body around, and you're not really used to it. So yeah, I think you're totally right. Get hands-on in terms of practicing those techniques and get used to normal is definitely a good way to go.
Yeah, definitely. I found the practical side potentially for me has been a bit easier. But I think, you do see it. People are a bit more tentative about getting hands-on and trying. Do you think part of that may be for a fear of making a mistake or getting it wrong?
It might be. I think some of it depends on like your personality as well. What you're used to doing. Some of the best physios we had in our year were the ones who'd been physio assistants, because they'd actually got all that practical stuff. That's been what they've been doing for maybe a year or two prior to coming to university. So all this stuff that you kind of take for granted further down the line, like getting your bed height right, movement and hand, all those kind of things.
Yeah.
But actually, when you're not used to it, it's really hard. It is really tough. I recall being a student on a surgical ward, an abdominal surgical ward, and having to get a patient out of bed. And the hardest bit about it was managing the drips, drains, and leads. It was like some kind of puzzle. Like, okay, right. So how do we get like this, the catheter and the drain and the drips out all on the one side, and they're strapped to the oxygen, and it's that kind of stuff. You're never going to find a research paper that takes you through that. But what you've got to do is think, problem solve and do it and get used to it. And there's a lot of value in that, I think.
Yeah. So practice makes perfect at the end of the day. And well, it never makes perfect in physio land, does it? But
no,
it goes some way towards.
No, but it helps your confidence and helps the patient's confidence as well, because once you've done it 100 times, you see those experienced clinicians, they go into that situation with that surgical patient to get them out of bed. They've done it a million times. You can see their thought processes of getting everything round to the right side of the bed. It becomes so much smoother, and the patient then feels so much more confident, because they're like, okay, yeah, this person knows what they're doing. Whereas, if you're not used to it and you forget a drip or drain or lead or what have you, or you're flustered, they don't have so much confidence in you as well. So the more we practice those practical elements, the better, I think.
Yeah, no, brilliant. That certainly ties into everything that I've covered at university as well. So obviously, Tom, you've kind of taken a course into MSK, and today that's really where we're going to focus. And what kind of brought you into that field? I mean, because physiotherapy, is most people watching this will know that it's not just MSK. We do neuro, we do respiratory, we do anything to sort of cancer care and palliative care and all sorts. So what took you down the path of MSK?
So when I was a student, I actually found the MSK stuff really difficult, particularly in my second MSK placement. And I think what was a barrier for me is that I was looking for very specific strategies for each patient, and not thinking more generally around like load management and education and applying simple principles. I found that really difficult. But when I first qualified and became a junior, one of my first placements was outpatients, and I had a really fantastic senior there, a guy called Mark Randall, who was really passionate, really interested, had loads of great ideas. And I think working with him and in that team there in Winchester, it just clicked for me. It just sort of fell into place a little bit, and it started to feel like a lot more natural. I started to get more confident with it, started to really enjoy it. And I think I knew from then, right, this is what I want to go into, really. And I did the other junior rotations, and I would encourage people to do the same. I think there's a huge amount of value in doing those other core rotations, but none of them quite appealed to me as much as outpatients did. So I then went on to become a senior, what was then a senior 2 in outpatients, after a couple of years of being a junior. And then it just kind of developed from there, really.
Brilliant. And for those watching this who may not know, it's a senior 2, are we talking kind of band 6?
Band 6, yeah, band 6. So, so we started off junior, as it was called, band 5, and then up into band 6 after that, yeah.
Okay, so that's interesting in terms of how you took that journey, because I know a few people, including myself, who coming into the end of the degree still have absolutely no idea of which area of physiotherapy we might like to go into. So it's keeping those options open, and you're saying that the rotations are actually really good for that.
Yeah, absolutely. I personally do think there's value in doing those core rotations, because there's a lot of transferable skills from doing those different things. And because, when we work with patients, they come to us with a lot of things that they might need help with that are often interlinked. So they don't just come with a musculoskeletal problem. There may be neural elements. They might have past medical history that involves, respiratory conditions. I do think it is very useful getting that grounding in your junior years, because it's only a couple of years, and then you've got the opportunity to specialize. You've got a long career ahead of you with that good kind of grounding of knowledge across a kind of breadth of different areas then.
Absolutely, yeah. And I suppose just to kind of throw a curveball in there, I know some people who, good friends of mine who are kind of quite adamant actually that they know they want to do MSK in there before they even started their degree, all the way through. That's all they wanted to do is MSK. What would you say to someone like that coming out of their degree and thinking, no, I just want a static position in MSK and because I'm really absolute about what I want to do? What would you say to sort of someone like that?
Yeah. I think of course you can do that. I'm not against that, and I've got friends and colleagues who've gone down that route. I think I would just try and make sure that whatever choice you make caters for your learning needs, because some people go straight into private practice, which again is absolutely fine. But it massively depends on the private practice clinic you're in and the teaching program they've got. In some private practices, they have quite established teaching programs, which can ensure you get the support and the development. In others, you'll find yourself pretty isolated, unfortunately, with quite a large caseload and without necessarily much time or supervision to develop the skills that you need to develop.
Yeah. So
you kind of firefight a bit to get through each session, and you don't necessarily develop the way that you would like to. So I think that's the thing. It's absolutely fine to choose pure MSK if you like, providing it caters for your needs. But don't leave yourself isolated and in a difficult position where you're not getting the support you need.
No, and I think that's a good top tip there as well. And it leads brilliantly on to one of our first questions, actually. And it was about managing that workload as a band 5, because you start as band 5 and you're really keen, you want to work really hard. But at the same time, we all know as physio students, actually, it's a bit like passing your driving test. You finish university, you then really start learning. So I think this question was about kind of balancing that working, but also continuing to learn, and any tips about CPD and how important CPD is as a new grad.
Yeah, I think the first thing to say is to recognise that your working is learning. and to recognize that the challenges you face just completing your role as a band 5 initially is really hard. It is really hard. You're challenged on a day-to-day basis, and so you need the support from your senior staff to begin with. And I think sometimes it's, if we try and then push a load of extra CPD activity on top of that, it can be exhausting. Right. So I would say, try and recognize that, the opportunities to develop within your day, and maybe then look to add little bits on top of it so that you don't feel overwhelmed with what you're trying to do. So a couple of things that I find quite helpful is there's a little reflective task. We call it the 3-to-1 rule. So you look at maybe a situation with a patient or any aspect of your day, and you think, what 3 things went well there, and what 1 thing could I maybe improve on next time? So it's a very quick reflective process that allows you to think, okay, yeah, some stuff's gone well. These are the things that went well. Mm-hmm. This is the thing I'd like to do better next time. And then even just noting that down somewhere, because, there's some power in writing these things down. And it allows you then to focus on working on that particular area you want to get better with. But I would also say, like, when we talk about reflection, we often do a lot of reflection on action. So maybe we sit down and we think about how a patient session went. So after the event, we sit down and we think, how did that go? What could I do better, etc. And that's valuable. Mm-hmm. But reflecting in action, I think, is really useful as well. So trying to have that reflective process whilst you're working with a patient, and even whilst you're writing up their notes. And I think a good example of how you can do this is your plan for the next session for that patient. It's so valuable, your plan. And a lot of the time when we're pressed for time, we write plan, review in 2 weeks, plan, continue. Yeah. But what? Continue what? And then what happens is that patient comes in 2 weeks, you open notes and you go, I don't really have a plan for this. Where that's an opportunity to reflect in action and go, okay, so what didn't I do in this session that I need to make sure I do next session? How can I progress this person? What tests might I need to review? How might I progress their exercises? What might be the next step in their rehab? And just literally popping down 3 or 4 points in that plan prepares you for the next session and gives you that little bit of reflection to help you think about how you can do things better. And 2 weeks later, you open up the notes and go, right, okay, I've got a plan today. I know what I'm going to assess. I know the tests I need to review. I know how I might progress this patient. And it all flows so much easier, I would say.
Yeah. Definitely. I think all students would be able to agree with that. If you've got a clear plan, it helps with your time management as well. In outpatients, you're on a conveyor belt, and especially when you come into year 3 and they're expecting you to do things quite quickly and manage autonomously a bit. Yeah, having that plan enables you to pick up the notes, go right, and go on. As well as you're saying there, it's a good reflection as well in That's brilliant. No, that's great.
Absolutely. I mean, I know I say, it is hard as a band 5. And I say that not to be negative. I don't want people to be concerned about it, because you will get through it and it'll be fine. But just to acknowledge that it's a challenge. No one finds it easy. And I think that's okay to go into it. This is quite a challenge now. Like, I've got a caseload of patients. I don't quite have the experience under my belt that my band 6s and band 7s will have. So it is a challenge. And to kind of treat ourselves with a bit of compassion through that challenge and not expect too much of ourselves. Time management is the biggest thing I think most band 5, most junior physios will struggle with. And I think, really trying to get on top of that helps a lot. Simple things like trying to make sure you get the patient's notes written up within the time you're with them. Because it's so hard to get to the end of the day and have a big stack of notes and try and remember each of those patients. You won't. So I'd really encourage people to get into that habit, really. And then if you want to do additional CPD, think about what fits your energy levels. If you're exhausted at the end of the day, that you're not going to absorb much more, I don't think. And think about what fits your time. And that's where things like podcasts are great. DIY housework and stuff I can do sometimes. So I stick a podcast on for 40 minutes, get a massive stack of washing up done, paint the spare room or what have you. And then it is not taking up time because you can be doing other things. So I think it's just sort of thinking around it a bit.
Yeah. I think that's a good tip in terms of maintaining that CPD. So you're saying sort of don't put that undue pressure on yourself as a band 5 to be thinking I need to do X amounts of CPD, but actually try and fit it into your, as you said, your fatigue levels and how you're feeling as you go through. Yeah, that's a good tip on CPD. Other sort of things on maintaining CPD. You mentioned podcasts there. Any other things that you'd say are good for newly graduates, sort of your band 5s to keep up with their CPD?
Yeah, I mean, podcasts are so useful because it's so easy to do. And I would also just take the time to think about where you need to develop, because that's the thing. Sometimes, because there's so much stuff out there on social media, there's so many different opportunities to learn these days, which is great. We can basically be directed by what's sort of thrown at us, if you know what I mean. Oh, there's that. I'll go and look at that. Whereas it should be the other way around. We should think, okay, well, what do I feel I need to learn more about? Okay, it's this topic. I want to, let's say, patellofemoral pain. Right. So now I'm going to go off. I'm going to find 2 or 3 good resources on patellofemoral pain because that's what I need to learn about, as opposed to, oh, my Twitter feed is a thing on, cervicogenic headaches. I'll do that. Do you know what I mean? So I think about what your needs are, and then go and have a look for some resources that will support those needs. I also think it's really valuable to find out ways that help to cement that knowledge. So I really find, for me, I tend to kind of content mine, I call it. So you take one research paper, you read the research paper, and you summarize it in an infographic, 4 to 6 key points in the infographic. That helps to cement the knowledge, which gives you something you can share on social media as well. I might then create that, turn that graphic into a slide I can teach with, and then teaching cements that knowledge as well. And so you've taken something small and turned it into something useful that you can share with others, and in doing so sort of cemented the knowledge as well. So I think work out what works for you for that, but that chatting to a friend about it, trying to share that knowledge is a great way to cement it, I think.
Yeah, I definitely tested that in my through the degree. Actually verbalizing what I've learnt cements it massively, and my poor fiance has listened to me numerous occasions talk about things, but it helps. I even talk to the dog and tell the dog about things sometimes. I remember doing the basal ganglia for Parkinson's disease and telling the dog all about it, and it does help. So I think that's a really good top tip, actually.
A well-informed dog. Yeah.
So I know that you've talked a little bit about kind of the MSK practice and writing up your notes and those sorts of things under time management and stuff. And I've obviously listened to a lot of your podcasts and some of the interviews you've done, and you always talk quite a lot about how important that subjective history taking is. And I thought I'd just kind of talk about that a bit, because I know some students actually find that they either find it quite difficult or they underplay it. I think sometimes it's seen as a tick box exercise. Okay, I'll get through. Boom, boom. I've asked that. I do threads, or I cover my drug history, my previous medical history. I've done that. Right. Okay, now I've got to kind of feel what's going on. Have you got any tips for students who are in that boat, or just really maybe too shy to kind of cover their subjective?
Yeah, I think one of the first things is to set realistic expectations for yourself. You've got your L plates on, if you see what I mean, when you're a student or when you're a new physio. You can't expect yourself to drive like Lewis Hamilton. Do you know what I mean? We've got to recognise that we're still learning that process, and therefore give ourselves a chance to do that, and recognise that we're going to make some mistakes in that learning process, because often if we're feeling very shy and very nervous, we're trying to expect ourselves to hit a perfection or a high level, and that just puts unnecessary pressure on ourselves. So I think bring that expectation level down a little bit. Give yourself the time that you need. If you don't get to it in session 1, you get to it in session 2. That's okay. Yeah. So I think that is important. Remember as well, like the patients are shy too. Actually, I think we don't necessarily recognise that they might come into us a little bit unsure about the session they're going to have and what they're going to go through. And once we recognise that, we kind of takes the level of stress down on us. Like we reckon, okay, yeah, we're only human. They're probably a bit nervous. They're not sure what they're going to be asked. We're a little bit nervous because we may be new to this assessment process. And that can help to reduce the nerves. I think taking your time and being prepared to pause for a moment and just have a little think. Don't feel you've got to kind of rattle through each of the questions. Take a moment, pause, have a look at the notes if you want to. So, just gives yourself the time to then come back to the question that you want to do. It does take time as well. Like it's the mileage that we need of seeing patients and recognizing patterns and seeing the importance of the information that we're going to get from them. That is not going to come until a little further down the line. So I think we've got to give ourselves that time, and then you'll find it gets better and better. And what you'll find you're able to do then is, rather than just ticking off the list, I've got to ask these things, I'll tick them off. You're actually more exploring the questions and answers to get the information that actually is useful for treatment. That's what's more important. It's not, let's tick off all these boxes. I've ticked them all, therefore I'm done. It's, have I got the information I need to help this patient? If you have, great, tick. Now we can move on to objective. If you haven't, let's explore it a little bit more and get a bit more information. And I've had some patients where I've only done the subjective in session one. They've had so much going on that I've chosen with the patient to say, okay, let's just really get your story today. Let me really understand what you're going through. Let me really get that down. And then let's next time test you out objectively, rather than rushing through it because I feel like I've got to tick this box and actually missing a load of important information. So I think there's flexibility in how you can approach it, really.
I think that's probably a really confidence building thing for students to hear, actually, to be able to kind of to not have that pressure, I think, that they put upon themselves, not necessarily from the department, as you say. Remember, you've got those, what is it, you have a green P, isn't it, when you pass your driving test, I think?
Yeah.
So think of it. Wouldn't suggest anyone goes putting a green P on their back when they're starting outpatients as a band 5, though, to be honest.
It's funny you say that, but I think our physio room's logo has a green P in it, so I'd probably still have one of those on me now. So,
well, I suppose it's one way. So there's, I think, kind of going on with what we talk about there. I think as students, I know I am, and I still am, and I know other students are. We're quite easily influenced by what we see on social media, what we get subjected to. We often feel that's what we should learn, or that's what we should know. And if we don't know about it, it kind of makes you feel a bit anxious. Do other students in the same position know more than me? And as I say, there's an awful lot out there. There's so much on social media. And it kind of just brings me on to another point, which this is a huge topic in itself. And I don't want to go too much into the nitty gritty of it. And I don't think we've got time today. But it's on that manual therapy. And I think as students, we've probably seen over, if you're a third year, you've probably had 3 years of it. And if you're a first year, you've probably seen it. Some heated discussions around manual therapy and what it shouldn't be, and whether it should be even there at all. And there's a lot of conversations that go on. So what would your advice be to students that have seen all of those and are easily starting to make their minds up on that? What would be your advice?
I think the first thing is to recognize that social media is not evidence. And it is very polarized. There's something about it that tends to push people down to the extreme ends of a discussion. And unfortunately, the way it is it seems to end up with people more interested in kind of winning that debate than they are interested in perhaps getting to what the truth is, whatever that is, about the topic. Do you see what I mean?
Yeah.
And it's human nature when people start to push a point forward that the other person feels confronted, so they dig deeper to find evidence to support their view, and hence it gets more and more polarized. And I don't think that is a true reflection of the situation. So I would watch those social media debates, but take a pinch of see them as absolute truth, because they're not really reflective of the bigger picture that's going on. If you want to get involved in those discussions as a student, do, if you want to. I'd really have a think about what you want your values to be, and how you want to communicate on social media. Do you want to get ranty and angry and confrontational with a fellow professional? Is that how you want to communicate? Up to you. You can choose that if you want to. Do you want to have a friendly chat and maybe a little humor in there, and actually maybe learn a bit from what they're saying? And I personally, I go for the kind of over a beer attitude. I like to talk to people on social media as if we're sitting there having a beer.
Yeah.
You know, I wouldn't suddenly become confrontational and difficult with someone I was having a beer with. You know, you have a bit of humor, a bit of chat. You when they make a good point, you acknowledge it, and that I find is a bit more useful. And on the subject of manual therapy, I think one of the things that happens, particularly in social media, is we place certain treatments on a pedestal and we make it sound like they're the gold standard and they work for everything. And that's not really reflective of the evidence that's out there. Okay. Actually, if you compare the evidence behind things like, say, education and manual therapy, I think if you were to kind of blind that and just call them treatment A and treatment B without knowing what they were, the comparative evidence would not necessarily strongly support education over massage, because there's not actually a lot of good quality evidence in education. So we then say, okay, well, massage or manual therapy, low value, education, high value. Well, why? If the evidence isn't that compelling. So I think we've got to just be a little bit more careful that we don't, push something up and say, this is amazing, it works for everything. This is rubbish, we should get rid of it, because that's not really a true reflection of what's going on. So I think then we've got to be consistent. If you're appraising the evidence, appraise it consistently. Don't give education an easy ride because you like that, and hammer a manual therapy paper because you don't. Yeah. And personally, I feel there can be a role for hands-on treatment within sessions. I see it as adjunctive care. So it may assist with other areas that I think are more important. I know the evidence isn't strong, but I think things like education and understanding the condition, load management, exercise prescription, those are going to be more effective long-term. But there are times where bringing in a little bit of hands-on stuff seems to assist that process. And you can do the two together. So if you're choosing to do some hands-on stuff, you're not doing it in silence. You might be doing some hands-on stuff and talking a bit about, like, how's your day at the minute? Take me through a typical day. What are your stress levels like? How are you sleeping? Yeah. And you're drip feeding lots of useful information about self-management, while at the same time maybe doing a little bit of work to loosen up a stiff ankle, or to help maybe do some hands-on stuff that might have some short-term effects on pain. So we think it can be used as part of your practice. It's just how you use it.
I think that's a well-rounded answer. Would you say you touched upon a kind of that polarization of, and we kind of know, I think really in our heart of hearts, that doesn't exist in physiotherapy, and there's never any clear-cut answers, and I don't think you'll find a single paper that proves anything to say it is absolute. And would you say as a student, you've got to maybe be really aware of your biases and where you're getting drawn down to, perhaps?
Yeah, absolutely. I think at all levels of our profession, we need to be aware of our biases. And also, I do think as well, it reaches the point where you need to stand for something. There's a kind of fashion on social media to attack everything. And I'm not a big fan of that. At some point, you have to stand by an approach that you want to use with your patients. And I think if you keep attacking everything and pulling everything apart, then you're left with nothing, and that's not a nice position to be in. There's quite a few physios that then feel very disillusioned, to feel there's not much they can offer because each of their approaches has been kind of pulled apart. Whereas I think if we look at each approach and recognize the pros and cons of each approach, and then try and reason through why it might be useful for each individual, that I think is much more useful. And I think there are times where maybe some short-term pain relief is actually useful for that person. A classic example is the week before a marathon. My clinic is nearly always full of people with aches and pains the week before a marathon. The classic one is, I've got a really tight calf and I've got a marathon in 3 days' time. How can you help me? well, you've got a marathon in 3 days time. I can't get you stronger. Maybe I can help your recovery a little bit, but we've only got 3 days. There's not many things I can change in this 3-day window that's going to make that marathon more comfortable for you to run. Yeah. And you get to know that person and like, this is really important for me. I'm running for a charity that's really close to my heart. I'm going to do this marathon. I really want you to help me get around it. Yeah. And if you're like, well, I'm not going to touch you, sorry, manual therapy, nope, don't do it. Have you helped them? Yeah. You know, have you actually helped them in that situation? Whereas you can assess them and say, okay, well, let's make sure that this is appropriate for manual therapy. Let's make sure this is not a DVT, for example. You know, let's you know, make sure it's a safe and appropriate thing to use. Then let's see if we might use some strategies to give them some short-term pain relief to assist them to get around that marathon. And then let's see them afterwards and then plan a more long-term strategy that might make sure we get rid of this calf pain completely, like getting their training at the right level, like strengthening the calf up, maybe looking to see how their running gait has changed, etc., etc. Do you see what I mean? Absolutely. We come in there with manual therapy, hands-on, no, don't do it. It doesn't leave us with any options in that situation, I don't think.
No, I think what you're alluding to there as well, and something I've learned probably more in the last 6 to 12 months is that every patient is going to be different. And on social media, you're exposed to these blanket views. And as a clinician, the skill, I think, comes into play in terms of looking at your patient who's sat in front of you and what's right for them at that particular time, and then applying all your clinical reasoning and your evidence base and putting it all together for that one person. So, which is kind of a lot of what you were saying there. So that's good. It's a hot topic. So I'm glad we covered it well there. Yeah. It's a good. So
I think one other thing just to add, James, if you don't mind, is there's a funny thing. Like, I think this is maybe going to sound a little bit philosophical, but I think sometimes we forget what it is like treating humans. Like, there's this conception that we think, okay, so I gave them this advice and I gave them these exercises and they'll go off and do it. But that's not the case. A lot of people, they don't follow advice. That's the truth. I mean, you look at some of the data in, say, stopping smoking, that, you know, will have been told repeatedly to stop smoking, but have advised repeatedly and educated as to why they should stop. You look at some of the data in actual people doing the exercises we suggest, that some evidence that 70% of people don't do their exercises as we suggest they should. So if our assumption is that, yes, we give them advice and education and it'll work because they go and they'll do it, that's not really what humans are like. Yeah. That's not what we're like. As you know, I treat loads of physios that are struggling to manage an injury quite often because they don't do the things that they know they should, even though they know they're valuable. So I think maybe we've got to be a little bit more realistic about what it means to be treating a person that isn't necessarily going to follow all these things that we say, and we have to be pragmatic and try and find a way that works for that person.
I think, and it kind of makes me think about the motivational interviewing and things like that we've touched upon in an undergraduate degree. That when you talk there about kind of getting people on board and finding that way, just telling someone to do something isn't. We're human beings, and as you say, the evidence isn't great that people go away and do exactly what we tell them because we're physios. So
absolutely,
definitely. So we go on to, obviously, this is a really broad question, really, actually, and it's kind of titled as in what's enabled you to get to where you are. And I think maybe kind of want to kind of close that down a little bit. Is this something you think, looking back, you think, yeah, that's really helped me get to where I am now? Because obviously, you know, you're a successful physiotherapist who's running international courses. You've got a website that's, you know, phenomenally well known, and on social media, you know, I think I happily say you're well regarded, certainly in the subjects and that you kind of cover. So what's kind of got you there, do you think, Tom?
I think probably the central thing is that I've found something that I'm really passionate about, which is running. And I think that has really, everything's kind of been driven by that, because that is what makes me see a new research paper and think, oh, I want to go and read that. I want to find out about that. I want to share that. And that has driven the whole process along, because the more and more I got into running injury, the more I was, really keen to find out more about every running injury I was seeing in clinic, to read all the research, to share what I was finding with others. So I think that if you can find something that you're really passionate about, then it doesn't feel like work. It feels like you're pursuing your passion, really. But also, it's fair to say I've been very lucky, in the sense that my website came out in 2012, and I was sharing a lot of stuff on social media then, at a time where there was a big social media boom. So a big boom, particularly in physio. So I sort of, by luck, kind of came out at the right time, that saw me, fortunately gain a lot of followers and a really, really good audience. And I'm also very, very fortunate. I have a very patient wife who has for many years now been like okay with like me burying my head in research papers and spending evenings and weekends working and reading and writing and all those kind of things. So yeah, I'm very fortunate that she supports my geekiness, basically.
Yeah, I can definitely agree with that one. Yeah, it tends to help massively, doesn't it? Having that. So you say about that passion, it's just kind of following that. And I suppose on the other side of that is not to kind of worry if you don't find that straight away.
No, absolutely. I've through my times in my career, I've had some very difficult times with it, where I was quite disillusioned with the profession. When I was first moved to Brighton, I did a band 6 general rotation when I came back from Sri Lanka, and these were sort of 8-month rotations, not just in outpatients but on the wards and everything else like that. And I'd said to them that I predominantly wanted to be doing outpatients, but my first rotation was 8 months on surgery and ITU, which wasn't my area. And then we were asked to rank the next rotations in terms of preference, and obviously put outpatients first. Way down at number 20 out of 20 was working in care homes, doing nursing home work. I put that at the bottom because that's not my cup of tea. But the way the rotations worked, I ended up getting my 20th choice out of 20. So for someone desperately keen to be working with athletes and runners and things like that, working in nursing homes doing elderly care rehab wasn't my thing. And I know it is other people's thing, absolutely fine, just wasn't my thing. And so I really wanted to get out of that and back into outpatients. And I went for, job interviews locally, just couldn't get it. It was at a time where there were so many people that wanted band 6 outpatient work in Brighton, where I was based. So I went through that stage of my career. I was like, am I going to get back into what I want to do? Am I going to be working in these rotations that don't really suit my passion? And then eventually things did click. I found running as my passion. And I was able to then, get into outpatients. 3rd attempt, 3 interviews, 3rd attempt, got in there. And then eventually actually purely into private work and everything else like that. So I think there will be people that are sitting at points in their career where they think, I'm not sure this is for me. They may be even thinking about other careers, but there can be light at the end of the tunnel and other opportunities that will come up that can completely, reinvigorate your career, really.
So persistence is important as well. If you've got something you want to do, keep at it. Don't be swayed off it because it becomes a little bit hard. I think that's a good point as well. And then there's a question came in, actually. This is quite an interesting one, kind of linking into that, on excelling in a particular niche, use of social media, and things like that. The question also comes with the secondary bit of, does Tom offer mentorship as well? So we'll come on to that in a second, but kind of you found that niche, you found something that you've got that passionate about, and you want to really get involved with. What would be your advice to kind of excel for yourself and in that niche itself? What would you say?
Yeah, it's a good question. I think first we like having about is where do you want to get with it? That's really important, because otherwise we can kind of work without much direction. And there's so much you could be doing. You could end up working very, very hard, but without necessarily getting towards your goal. So have a think about what your goal is from it. And my goal was always, wanting to feel like I can do the best job possible treating runners. So I want to learn as much as possible about this topic so that, it helps me treat my runners. And that's why I think I enjoy it so much, because I read a new bit of research and then the next day I might be working with a runner thinking, oh, right, I can see how I can apply this here, and then seeing the results that come from it. And that's incredibly satisfying. And that makes me want to keep that process going. So I think, have a think about your goal, and then think, what are the best ways to achieve that goal? And for me, it was about trying to gather the evidence as much as possible, read the evidence, and then reflect on how it can be applied in practice. And I wanted them to share that as well. And I think sharing what you're learning as you go is going to be really helpful for others, which is great, but it's also going to help to cement your knowledge, and you'll learn new skills. Like you have, James, like doing work on YouTube, presenting on social media. Those are new skills that we kind of forget that we're learning as we go, but they're incredibly valuable skills. Creating an infographic to share is very, very, very easy. And you can use something like Keynote, which most of us have, and knock up an infographic in 5 minutes. But so you develop these new skills, and then you're able to share. And if you're wanting to grow an audience on social media, if that's part of your goal, I think you want to try and think about how you want, what your values are, what you want your voice to be, as I said. And also try and make sure that you're useful. You're sharing stuff that people are finding useful, and they're going to want to reshare that stuff. And if that's the case, you're going to grow your audience, and you're going to be helping people, and that's great. I think it's kind of win-win, really, in my book.
Yeah, I think that's a good answer there, in terms of finding that and then kind of being the best at it, or knowing as much as you can about that one thing, but having that focus is quite key. And I like what you said there about social media. I think it's, from a student perspective, I go back to, I haven't got it with me now, but we're just currently doing one of our final modules and going back to the HCPC standards for proficiency and professionalism and things like that. And I'd always signpost people back to that sort of social media guidelines, because we are health professionals. I think it's really important to be aware of those guidelines, but also about yourself and what you want to portray out there to what could be potentially, if you get into your niche, could be millions of people. So
Oh yeah, absolutely. And there was something I want to just come back to quickly, James, that you mentioned earlier, like sometimes as a student, and this is true at any stage of your profession, you kind of worry about what other professionals know. Maybe they know more about this topic. And we can worry about that. But I would encourage people not to do that, because you nearly always will assume that people know much more than they do. So don't worry about that side of things, and also recognize that there is definitely someone that knows more. Absolutely, there always will be. We can't chase that thing of trying to make sure we know more than everyone. But my experience is people tend to know probably a little bit less than we might anticipate. I was really surprised. I taught on a master's program a little while ago, and I expected them to know all the papers. I thought, these are master's students, they'll know all of these. So I'd be like, oh, so you'll know this paper by so and so and so and so. Blank looks. Oh, okay. Well, so you must know this. This is key. You mustn't. No. Okay. And I've learned that through teaching others, that quite often they maybe don't know about areas that you're interested in. So share it, get it out there, because then you're going to help them to know.
Definitely. And I don't know whether it's I've really enjoyed using Twitter, and I think just coming on from that, I know this is an interview for you, so I don't want to talk too much, but it's I found from my personal experience as a student, actually putting yourself out there, certainly on Twitter, you get an incredible amount of support from fellow physiotherapists. I think physiotherapy is an incredibly supportive profession. And genuinely, 99% of physiotherapists out there want you to succeed and want you to do well. So I think kind of just backing what you've just said there, Tom, I think it's, don't be afraid to put stuff out there and worry about someone who knows more than you. And as a student, worry that they might attack you for it or something like that, because I haven't had that at all. So that's worked really well.
That's it. And actually that fear is not just there in students. I know some fantastic physios that are actually qualified and publishing research who won't publish on social media because they're concerned about being attacked. And that's a shame. And that for me is part of the reason why I personally, I don't like being aggressive on social media, because that's the downside. You've got people that could be sharing really interesting views and ideas, but they don't want to do it because they don't want to get shot down. So I think share stuff and expect occasionally for someone to try and shoot you down. It will happen, but it's not a reflection on you. It's a reflection on social media. And then you just got to choose how you want to react to it. Stay true to your values and your voice. So for me, when I get attacked on social media, if I feel they're making a good point, I may acknowledge it. But in many cases, I will just choose not to engage with that person. It comes back to that over a beer rule. I wouldn't want to have a beer with someone who comes running up to the table and attacks you before anything else. Why would you choose to? Come and sit down. Let me buy you a drink so you can shout at me for 10 minutes. But we do that on social media. Oh, right, you're being horrible to me. Okay, let's have a chat and give you the opportunity to be more horrible to me. Choose to disengage with them if they're not on the same wavelength, because you can get sucked into a black hole. And I've done that so many times. I've lost whole weekends trying to convince someone, trying to win, like we talked about. It won't happen. You just lose a whole weekend, and you lose out all of the other things you could have been doing at that time. So choose about the ones you want to engage with, I would say. Definitely,
and think of your own stress levels as well.
I
think another thing you mentioned earlier as well, which I thought was quite key, the infographics that you talked about as a learning tool. And it's something that I've thought about. And I wonder whether universities might start asking students, even if informal assessments, to put infographics together. We do poster presentations, so the academic posters. But what would you say to that in terms of as an assessment tool, putting an infographic together?
Yeah, why not? Because you can assimilate lots of different skills into that. So let's say you make it about a research paper. So first and foremost, you've got to read and analyze that research paper. That's a very, very useful skill. Mm-hmm. Then you've got to summarize that into an infographic. And typically I might choose like 4 to 6 key points to put in that infographic so that it's not overwhelmed with stuff. And whether you can then include some images in it that support the points you're trying to make. So I think it would be good for analysing papers, for learning how to share that information, being concise, and for the extra skills you get from developing that graphic, the IT skills, the design skills. I think there's a lot to be had out of that. Yeah. Then, of course, you're interlinking it with social media, you're learning how to share it in the different platforms. For example, you share it on Twitter, you tag in people that you think might be interested in the graphic. So, because you can tag people into the image, and then they're going to be happy because they're thinking, oh, this is something I'm into, and they're more likely to share it, and then it increases the audience. So yeah, why not? It's a very real world skill, I would say.
There we are. We've heard it here first. We're probably going to get some comments saying my university already does that now, but hey.
Yeah, good. If they do, great.
Exactly. So we go on to now some of the kind of more coming into your running stuff, and I'm aware of time, but this one looks at the biggest mistakes a physio can make when treating runners. And personally, I'd like to kind of just caveat this a little bit. Tom recently did a very good interview on the BJSM podcast. British Journal of Sports Medicine podcast. I think it's only about 20 minutes long, I think, Tom, isn't it? But it really nicely, succinctly talks.
Yeah, it's a short and sweet.
And it talked very much about what physios can do wrong. But kind of summarise, though, is there anything key that you think in answer to that one, Tom?
Yeah, if I'm thinking of maybe like three key things, to focus on. One would be not applying load management well enough, really. So, not really working with that runner to find a manageable level of running for them and progressing from there. Because it's central to what we do with runners. It's really important. We want to work towards their goal, and their goal is often to be running a certain distance or certain speed. So really make sure we bring the trainer and we progress it towards that distance and speed. Without that, we're not really achieving their goals. So that would be the first point. If you're not managing their load and it's above what they can cope with, then they're just going to stay sore. It's very difficult to calm things down if they train above a level they can manage. Number two would be not taking the time to actually explain the injury to someone so they can understand it. I do a lot of second, third, fourth opinion work, and it's amazing how many people have seen 4 or 5 professionals and never really been told what's going on or had their injury explained in a way that they can understand at all. So make sure you do that in the first session. And these are my kind of session 1 standards I try and have. Get the load at the right level, explain the problem to the person so they can understand it. That's session 1 stuff, really. And then number 3 would be to try and make sure that we use the right exercises with people and we progress them appropriately. It often surprises me to see people who see multiple professionals and their exercises, they're not appropriate for them. They've got hundreds of them, but they're not dosed at the right level or not loaded enough to get strength change. One of the videos we've got on our student resource page that you mentioned earlier is about loading at the right level to get the change that you want from strength exercises. So I think those 3 things, if we're not doing those are the big mistakes you're going to have, with your runners. So get those in place early doors, and then think about what else you want to add to it.
And when you verbalize it, when you say it out loud, it sounds so simple. It sounds almost obvious, but as you say, it doesn't tend to necessarily happen. So yeah, that's a good one. And then when you're treating athletes, obviously, Tom, you've got experience of treating high level athletes and amateur runners, or just your everyday typical person. What would you say the key differences and similarities are in treating those kind of people?
There definitely are similarities. Before I was working in running injury, I was actually working in chronic pain. And actually, I found a lot of the principles of chronic pain worked really well in treating runners. People might be a bit surprised by that, but in chronic pain, we want to try and make sure people are active, but we need to find a level that they can manage, and we need to work towards a goal, like we've talked about with runners. You still need to find a manageable level and progress towards the goal. We want to, with both runners and people with persistent pain, help them to understand their condition, and both groups can display things like fear avoidance and fear of damage. That's not specific just to persistent pain populations. So taking the time out with both to actually explain their pain and to recognize that it's mainly down to sensitivity of the tissues rather than damage is going to be important in both groups. And thinking about the drivers for their particular pain and their particular presentation in both groups as well, because when we think about it with our persistent pain patients, we might think about beliefs around movement, about fear of damage, about fear avoidance and those things. And they may well be present in runners too. But also in runners and athletes, we want to think what drives their training behavior. Because if we don't get to that, we're going to struggle to change that behavior. In the same way, we might struggle to change the behavior of a persistent pain patient. They might be moving in different directions. If you see what I mean, the persistent pain presentation, we maybe want them to do a bit more. In athletes, sometimes we might want them to do a bit less, but we still have got to get to the drivers behind it. And a lot of athletes believe they need to push themselves 100% in every session. They need to train hard all the time. They cut out rest and recovery because they believe that that's going to get the best result for them. And if that's a strongly held belief, us as a physio simply saying, well, don't do so much, is not going to work. In the same way as if a patient believes movement's damaging, telling them to do more movement, it isn't going to work. So we've still got to get to the beliefs and the drivers underneath it, really. Yeah. I guess the big difference is the levels you're aiming for are going to be very different. We've had people go back and do multi-day marathon events, 96-mile ultra marathons, trying to compete at an international level. For athletes, that is a very different end goal. For a persistent pain patient or someone else who may actually be just looking to be able to walk to the shops and back. So that is when there's going to be difference there, but a lot of similarities too, I think.
Definitely. I think my tip for students from what you just said there is going back to what we are taught quite a bit about behavior change modules and things like that. And we taught that at university, and sometimes I know at my university, we taught a bit about it in the first year, and it didn't quite seem to kind of fit where this sat in being a physiotherapist. But I think what you're saying there actually is a big part of it. So if you're a first year right now and you're covering behaviour change, pay extra attention, because it will serve massively to help you as a physio, as Tom's just said. Next one's I quite like this one actually. Self-diagnosing injuries as a physiotherapist. Pros and cons: should you ask others or trust your own feelings about rehab?
Yeah, good one. I think sometimes you can, absolutely. I think it's good for our self-efficacy to trust ourselves, and to try and do that. But I think sometimes if that's not working, it's worth seeking another opinion from someone else, because it's the thing that's difficult for us to do is to remain objective about our current situation and to assess it objectively. And sometimes I think we need someone else to do it. So I think, in the first instance, see if you can self-manage, because in many cases I think we can. But if you're finding you're struggling with that, or you're feeling particularly worried or anxious about it, struggling to be objective, then I would, check in with someone else to get their guidance, their objectivity. There can be a lot of reassurance in that as well, particularly if you're worried about it, of having someone else detached from the situation, be able to assess it objectively and give you some guidance there.
No, that's good. Excellent. And then I've got one of these kind of wrapping up the student side of it. 3 things that you tell someone starting their degree in September. So we are now, we're on the 24th of April right now. So you will have, I think, quite a few students will have been accepted into university maybe, or certainly have gone for interviews. Or if not, when they do apply and they start in September, what kind of things would you say to them starting out fresh on their physiotherapy journey?
Well, you might be able to help me with this a little bit, James. When I was at university, like the first term, particularly, most of the first year, there was a lot of anatomy and physiology in there. Would you say that's still the case in year 1?
Yeah, I think it very much depends on which university you go to. They're quite different, but I think as a general rule, you cover a fair bit of anatomy and physiology in your first year to get a grounding.
Yeah. So that would be my first point, would be to familiarize yourself with some anatomy and physiology, particularly around some of the stuff that a lot of us at uni found hard, was trying to remember muscles, their actions, their attachment, those types of things. Spending some time now learning about some of that and working out what helps it to cement in your mind is really useful. You can learn a bit about the topic, but also your learning style, what particularly helps you to learn it. Some people like to do drawings of the muscles and their attachments and things like that, for example, because it helps them to cement it. So I would definitely think about anatomy and physiology and getting on top of that. And if that's not the start of your course, if there's other topics that are coming up at the start of the course, you could find out from the tutors perhaps what other areas you could learn a bit more about. Because certainly for me, I remember it was a lot of work year 1, going in, a lot of new learning. So if you've covered some of that going into it, it just makes it a bit easier for you. Point 2 would be experiment with exercises a little bit. We can do this in lockdown now, because actually there's a lot of value in learning how to exercise, how exercises feel, how to adjust them to make them work certain areas. Why not spend some time trying out some squats, some lunges, some deadlifts, some calf work, play around with a little exercise routine, and you'll learn a lot about it. It comes back to that kind of practical discussion we had earlier. You can go and read a research paper about muscle activity in running, and I love that kind of stuff. I'm a big old geek. But when a patient's sitting in front of you and you're working with them, what you need to know is well, how do I work that muscle? How can I make this harder? How can I make this easier? And you can do that at home. You can work out a lot of stuff at home. And then point 3 would be buy some decent underwear. When I was at uni, we had I was another shock to the system. I remember literally pretty much the first lecture. It's like, right, come in, we're going to be doing looking at anatomy and things today. So right, everyone's stripped down to your undies. We're going to have a look at muscle bulk and all these kind of things. Stock up on your good pants, basically. That's point number 3.
To make people feel a little bit better, if you are, I think things may have changed slightly Tom. I know from
This was 20 years ago, of course. Yeah.
we're not told to go down to our underwear quite, but we are definitely told to wear shorts and a t-shirt that you can readily take off, and for the girls and women in the class to have a sort of a strap top or something so you can see the anatomy. But yeah, why not get some decent underwear anyway? You know,
get some decent underwear too. It shows how long it's been since I went to university. We didn't have any of those niceties then. It was just literally like right down to your pants. But yeah, it's good. The profession is improving. I'm glad to hear we're going in the right direction.
Brilliant. Okay, we've got a couple of. I was going to talk about kind of new graduates, but I think we've covered loads of that already. I think about that sort of stuff. Okay, so now we've had a couple of running specific questions, which was inevitable. So we've got a question about exercise treatment for overpronation causing MTSS, so medial tibial. Oh God! Right, cut that out.
Keep it in. Medial tibial stress syndrome.
Exactly. Yeah. So exercise treatment on overpronation causing medial tibial stress syndrome when running, and typical running recovery outcomes.
Yeah, very good question. Yeah. So just to touch upon this term overpronation, I think that is a term that's a bit controversial these days, because how do we define it? You know, what's too much pronation? What's excessive? What's not enough? So I think I would encourage people perhaps to move away from terms like that a little bit. We know that pronation is actually a normal part of load absorption during running. So what we don't want to do is demonize it, because a lot of runners will think, oh my gosh, I'm overpronating, I've broken, and this is a bad thing. So it's just a normal part of running to absorb load. But I would think perhaps about how having a large amount of pronation may influence the load on the tissues. That's the way I would look at it, not as good or bad, but how might it influence the tissues. So if you've got a large range of pronation to control during running, what structures are going to be under more load? Well, tib post, because that's going to be one of the main restraints to that movement. Possibly the Achilles. There is some thought that it may provocatively load the Achilles, although that is debatable. There is a little bit of evidence linking more pronated foot type to medial tibial stress syndrome, because it may increase the kind of bending forces upon the bone. So it could be that, yes, that could be implicated in increasing the stress on the medial tibia, and therefore it could be a part of the problem. But that's different from sort of demonizing it as overpronation, if that makes sense.
Yeah.
So then we kind of got like a couple of answers in here. One is like, how do we manage medial tibial stress syndrome? So I'll come to that in a moment. The other is, how might you manage the pronation if you think that's part of it? So let's get onto that bit first. So if you think that the pronation movement is increasing the load on the medial tibia, and therefore you want to reduce that movement to reduce the stress on the tibia, one way we could do it would be to look at the running gait cycle. So when we run, if we land very narrow, what we tend to do is land more supinated, and then we've got a larger range of pronation to bring the foot flat. So really, it's an important component. You could look at them running and possibly get them to increase their stride width a little bit, so they don't land so supinated, and there's a smaller range of movement for them to cover to reach the ground. So that would reduce potentially the range of pronation, and you might expect it to help to reduce the stress on the medial tibia as part of that. If you wanted to alter some of the forces involved, you could work with a podiatrist perhaps to think about orthoses. Now, we don't think these consistently change the movement that we see necessarily. It might not change the range of pronation, but it can help to alter some of the forces involved and perhaps reduce some of the stress on the medial tibia. So if you're looking at that part of the management, that might be how you would think about it. But I would say that's probably a smaller part of the management compared to the kind of bigger whole of managing medial tibial stress syndrome. So I would say what's more important is, first of all, load management for runners with medial tibial stress syndrome. Very important. And they don't do very well running through pain. They're a group that even low levels of pain, it doesn't seem to work very well running with pain. So one of the key things is to bring the running down, ideally to minimal pain or no pain levels. And in some runners, they'll need a short break from running in order to do that, because it can be quite irritable. It doesn't matter if you're trying to change the pronation side of things. If they're continuing to run through pain and they're irritable, I don't think you'll find it changes it too much. So get load management in there, help them to understand what's going on. Important. We think it's overload of the medial tibia. It's a bony stress injury. So we need to help them to understand that. It's not about damage to that area necessarily. It's reacting to excessive load. We want to try and see if we can improve that leg's ability to manage load, and strength work will help with this. And particularly, we think that the calf complex helps to reduce some of the stress on the tibia. So I would often assess the strength of the calf and try and strengthen that up, and look at any of those other muscles in the limb that manage load. Quads and glutes are two big muscles that also manage load at the same time. So we could strengthen those muscles up, the theory being that then the muscle manages more of the load and there's less stress on the skeleton, less stress on the bone. But also strength work for muscles, because they attach to bone, can actually have positive effects on the bone's ability to manage load as well. So it's not just about getting stronger, it might actually have positive effects on the bone. So we've got load management, we've got exercise prescription for strength. You could also think about a bone loading program. Now, bone is a tissue that doesn't respond well to long periods of loading without rest. What happens is it adapts to the early period of load, but then it reaches a saturation point. So you're not going to get more adaptation from, say, 2 hours of running than you would do from maybe as little as 5 minutes. What does seem to be the case with bone is it adapts better to short periods of impact loading separated by rest. So what I might do is have a loading program where we say, okay, well, let's do a couple of minutes of impact, maybe jogging on the spot in the morning and in the evening. So we're getting short periods regularly to stimulate this bone and try and improve its capacity to manage load. And I'll often do that, particularly in a runner, they might not tolerate running. I might say, well, let's use these short periods of impact to build that tolerance. And then once you're less irritable, let's reintroduce running as well. And then we've got the other things to think about here is we're talking quite bone focused here, but thinking about the person as a whole. Bone health is influenced by diet and by sleep and recovery. And there are a number of things that affect that bone's ability and capacity to manage load. So we'd want to be asking, how is your sleep? Are you getting enough sleep? Is it restful for you? Have you got adequate recovery? What's your diet like? Are there other things that we can do that can actually help your bone and its capacity to manage running? So I think that's the bigger picture. Yeah, maybe some gait changes, but that's not number one priority. You know, get the load management, get the strength and conditioning, educate the patient, maybe bring in a bone loading program, then think about running gait, orthoses, those types of things really.
Yeah. Okay, good. It's quite a big picture stuff. It's looking at the patient as a whole. So no, that's great. This is quite an interesting one as well. So thoracic mobility and in rehab, and do you include it?
Honest answer is not very often. I've yet to come across many runners where they're thoracic a big piece of the puzzle for them. You don't need a huge amount of thoracic mobility for running. But it's always about individuals, isn't it? So if someone's presenting with thoracic spine pain, then yes, I certainly would want to have a look at their range of movement, or even perhaps maybe some aspects of shoulder pain or low back pain. You might include that within your assessment. But if you look at most runners, they're not going towards end range for their thoracic mobility during running very often. So I think it's probably less of a limiting factor than we think for most people.
What about sort of other general presentations? Do you find that you use thoracic mobility at all in any other?
Yeah, I mean, in areas where it might be relevant, as I said, thoracic spine pain, obviously, sometimes in shoulder pain, if you get someone who can't get anywhere near end of range, glenohumeral flexion because they've just got no mobility in their mid back, then yeah, absolutely. If you think the stiffness in the middle of the back means that they're having to move more, perhaps in the lumbar spine, possibly. But my specialism is, running injury, lower limb stuff. So it's not something I spend a lot of time looking at, really. I think if you've got a very stiff ankle, that's going to have a much bigger impact on how you're able to run than having a slightly stiff thoracic spine.
Yeah, brilliant. Okay, right. So I've got a few questions to finish off with, Tom. I know I've taken up loads of your time already, but
it's been great, James. I've enjoyed it. It's really good.
Yeah, good. Next time we need to have an actual beer, I think. So we've got, these are from me really, because I think out of interest really, a research paper that's quite old, but remains important to your practice. So like a seminal paper that you've not forgotten.
Yes. Yeah. So, well, I wouldn't say it's that old, but because it's 2014, so it's not that old, to be fair. But I think it's a really good paper if you're interested in treating runners. Would be Warden et al.'s paper on bone stress injuries in distance runners. It's a fantastic paper to read because it combines a lot of these different aspects we're talking about. So it talks a bit about like the pathology of bone stress injuries and how like the load on the bone and the capacity to manage that load are linked into the pathology itself. It talks about the various strategies in terms of returning to running, potentially gait retraining, strength and conditioning. So as a paper, it encompasses a lot of different aspects of care for a runner. So I'd say it's a really good one to read. It's in the Journal of Orthopedic Sports Physical Therapy. I think maybe perhaps we can put a link in the show notes or something like that. Yeah, really fantastic paper from Stuart Warden and colleagues. Very much worth a read.
Fab. Okay. Yeah, as you said, we'll put a link in the show notes and any posters go out on as well. And then kind of off that, a recent paper that you've read and it's genuinely changed your practice.
There's a really, really good paper by de Jong et al. That I've read in the last couple of weeks that has really struck a chord with me, and it's about passion in runners, about what they call harmonious passion and obsessive passion, and how that might influence things like recovery and injury risk. Just to summarize it in a nutshell, like harmonious passion is when we have a passion for a sport or activity, but we're in control of that activity, and therefore that sport sits within our life quite nicely. Obsessive passion is where we've got a passion for that sport or activity, but the activity controls us, and therefore that sport might sit in our life despite the fact that it has negative effects on other aspects of our life. And I think that struck a chord with me because we see a lot of runners who have that perhaps more obsessive passion for their running, and they're really unable to stop, or they really struggle to stop running. So that's a driver for overtraining, that unless we address it, they're just going to keep doing it. So, that's where I think we've got to take the time out with those runners to actually see if they can reflect upon their relationship with their sport and see if they can notice that perhaps it's become a little bit negative, it's having a negative effect on their life, they're struggling to stop, so they can be the agent for change in that situation. That's de Jong et al. 2020, and I think that might be an open access one. I think both of those papers, the Warden et al. As well, might be ones you can easily access. So we'll see if we can find good links to those. Definitely both worth a read.
Yeah, I mean that latter one sounds, I think, from my experience in running as well and coaching, things like that sounds fascinating. So I should be definitely picking that up. So another question for you: if physiotherapy wasn't an option, what other career would you have got into, do you think?
Ooh, good one. So I have a few options here. You might be surprised, but I did attempt and had a failed career as a stand-up comedian. I just couldn't. Was too nervous. I just couldn't be myself on the stage quite enough. But I learned a lot from it. It's part of the reason why I feel quite comfortable talking to groups of people, because once you've attempted to be funny in a pub full of drunk people and it's gone horribly wrong, you can kind of do anything after that. And the other thing is, I think I really like my writing. I think I'd have enjoyed being an author. I mean, I was offered a book deal a little while ago, but that was about running, running injury book. But we turned it down because by the time you finish writing it, it's kind of almost out of date. And really, my website is my book, if you see what I mean. I'd rather have something like that you can update regularly than plow, a year or two into a book that then once it's published, you pretty much got to get a new version out straight away again.
Yeah, definitely. That's the problem with the especially with physiotherapy, the fast moving and quite prolific in terms of evidence base. It is changing, and for students, it is difficult because it does change very quickly. As you say, a book changes very, very quickly. Just off topic, Tom, actually, it's not off topic at all. You talked about the papers, the Richard Blagrove, the strength and conditioning. I don't know if I'm sure you're aware of kind of his latest stuff.
Yeah, I know Richard's work. Yeah.
Yeah. Would that be something that you think, from a point of view? I know it's a paper that I've found really useful to read. The strength and conditioning stuff that he's done.
Yeah. Absolutely. I use Rich's work in running repairs course and the online version of the course. Yeah, Rich's work is fantastic, and that's a systematic review. I think you're looking at something around 500 participants in total across the studies they've looked at, examining the effects of strength and conditioning for running economy and performance in runners. But what's really nice about that review is there actually are some practical recommendations for applying strength and conditioning in clinical populations, if you see what I mean. So I would have a read of that, read those recommendations from Rich's work. He's published lots of good stuff. I think he's did a paper recently on strength and conditioning for adolescent athletes as well. That's well worth a read. So yeah, definitely have a look at Rich's work. He's on Twitter as well, actually. He's really, and Instagram. He's a really good guy.
Definitely. Fab. Okay, so question you didn't know I was going to ask you. What's your favourite cheese, Tom?
Oh, cheese question. I'm on the camembert at the minute. Yeah, that's my addiction at the moment. I am a recovering cheese addict, so I've moved off the hard stuff onto the softer stuff. But yeah, I love a bit of camembert, some stinky camembert, nice glass of wine. Yeah. Usually followed by a bit of indigestion, but you can't have everything.
Do you like it baked?
Yeah, I don't mind it baked. I just like it sort of left out of the fridge for about an hour or so that it's not chalky, so it's kind of like nice and melted and ready to go. And then some good bread. Yeah, it's good.
Just so
You're making me hungry now. You're making me hungry now, James.
Just so everyone knows, that wasn't a completely random question. If you follow Tom on Twitter, you'll see in his introduction, it's got about being a bit of a cheese lover. So that's where that question came from.
It's true. It's all true.
Being a complete weirdo. And then this is something I've actually got this from another podcast. So I think it's now I should remember it now. It's a running podcast. I think it's Let's Get Running. And it's a question they always finish with, and I just really like it. It's, can you recommend something? It can be a book, an experience, a course, a film, a life hack. It can be anything at all. What could you recommend people watching this?
So I've got a book, and I think I've got a little life hack for you. So there's a book that I really enjoyed called Superfans by Pat Flynn, and what it's about is maybe a change in attitude towards how we communicate, particularly in things like social media, because we're kind of in a rush to get thousands and thousands and thousands of followers. But he makes this really important point that you're better off having a small group of followers that you engage with and you have a connection with, that really know you well, than having thousands of followers and not catering for those followers, because you're not really engaging with them. You're just looking to share, get your audience bigger and bigger. So that's a really good book, Superfans by Pat Flynn. Really good read. I've listened to the kind of audiobook version of it, which is quite good because he kind of goes off topic here and there, so that's definitely worth the read. And then a little life hack. This is a surprising use for resistance band. So, obviously we can use resistance band for strengthening and what have you, but you can also use it to tackle stubborn jars. So if you take a jar that you can't get open, and then you pop your resistance band, I don't know if you can see that there, kind of around the lid.
Yeah.
Then it creates a lot more friction to allow you to open it. So I will often say, if you've got maybe a patient with like osteoarthritic hands, We might give them some TheraBand stuff to strengthen up with, but I might also say if you're struggling with jars, get that on the lid of your jar, it'll open up straight away. Marigolds, even better. There, so most people have got a pair of those. You put them on both hands, then you've got like huge amounts of friction, and you can get pretty much any jar open like that.
Mind blown.
But this is the thing about practical solutions.
Mm-hmm.
I'm quite confident you won't find a research paper on that. But a lot of what we've got to do as physios is practical solutions. How do we find a way of helping this person do this activity that they can't do? Yeah. Like those are the kind of things that are really valuable for us. So the more we can learn about that, that's not specifically rubber gloves and what have you, but about practical solutions, I think the better really.
Definitely. Yeah, we tend to be pretty good at problem solving and coming up with ingenious ways to do all sorts of things, including open jars that don't want to be opened.
Absolutely.
Okay, so I think we've covered loads today, Tom. We have gone on way longer than we even anticipated, but I think it's been absolutely gold stuff. I think hopefully everyone watching this will agree that there's something for everyone: first, second, third years, new grads, people looking to start their physio journey. So first of all, from me, thank you so much for coming on and going through all of this. It's been useful for me, apart from anyone else watching this. How can people find you? I think, because I'm sure from this, people want to kind of get to know more about you and what you do. So,
well, the first thing to mention is that we've got this free student resource page that I've put together because at the moment I know a lot of people can't get musculoskeletal placements. So that it's all on the Running Physio website, but hopefully we can share a link. It's all free. You don't have to sign up or anything. You can just go there, and we've got some videos there that you can enjoy, hopefully. If you want to reach me, I'm on Twitter. I'm at Tom Goom. I'm on Instagram at running.physio. And we do have our courses as well, the running repairs weekend course and running repairs online courses as well that we do for people as well. But yeah, if you have any questions after the show, pop them in the comments. Hopefully I'll be able to put this up on my student resource pages as well, so it'll all be within there. And I look forward to seeing what people think.
Absolutely, definitely. Well, given that this is going to go out onto YouTube and I think we call it evergreen, so it could be watched in 10, 20 years time, we'll make sure all of the links are below in the information of this video if you're finding on YouTube, so it's relevant and still up to date. So Tom, thank you so much for coming on. It's been a real insight into your knowledge, but also just a really good conversation. And as you say, it's on social media, it's a conversation over a beer. But this morning it was with a drink of water and a coffee, but it's been great. So.
Yeah. Well, next time we'll try and arrange a beer. When it's not done early in the morning, I think we'll trouble if we're drinking beer at like 10 in the morning. But yeah, let's do it again. Let's do it again. Yeah, I've really enjoyed it, James. It's been really good. So yeah, well, perhaps we'll get some more questions off the back of this. If people want to send in more questions, we can chat again and answer those questions for people if it's helpful.
Super, brilliant. All right, thank you so much, Tom, and we'll speak to you soon.
Cool. Take care.
Cheers.